Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A better life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
All right. Hello. Good morning, everybody. It's Wednesday, and that means it's 9 o'clock in Atlanta, Georgia, and that means it's time for Ageless Blueprint. And I am Dr. Taylor, the hormone doctor, and also the spiritual MD. And today we're going to try and tackle some more hormone confusion. You know, I can't help it. I somehow I get these notices from this Facebook group about bioidentical hormones, and I see so much confusion there. It just aggravates me so much that there's so much confusion, and I'm here to try and end hormone confusion. And I just saw a study that looked at, and we're going to talk about that today, a study that looked at over 7,000 women in 20 different countries. And they were looking at the difference between the women who had problems premenopausal and then postmenopausal. And what you're going to see is that there's a big difference. And what I think might be surprising, at least it was surprising to me, is what was the number one symptom that people reported that bothered them the most. So what we're going to do, we're going to get into these slides, and please, I want you to ask questions, and I may try to engage you a little bit because I want to see how many women have actually experienced this. Okay, so listen closely and see if you see yourself in any of this. So, all right, they saw women who were postmenopausal. They had 52% more symptoms. But here's the thing. There's no real measurements. They knew they had symptoms, so that's why I say, everybody goes by symptoms. And what I want to talk about is how do you go in and measure these things so that you don't have to wait for a symptom? Because by the time you have a symptom, things have been brewing for a long time. So the symptom is usually the end result. So what you would like to do is to find out what is brewing underneath, stop it then, and then it's much harder to stop whatever's going on after the symptom has already occurred. So what you want to do is be able to measure it and figure out things before. So let's look at this. So the number is real. So they did a survey, and they saw that 52% higher, so 7.3 women compared to 4.8. Perimenopausal, they had a lot more symptoms than they did premenopausal. Now, I will tell you, premenopausal women have symptoms too. I just did a TikTok video about PMDD, premenstrual dysphoric disorder, or severe PMS, and it's gotten so many views. And so these hormone issues are affecting the young and the not so young. I don't want to say old, the young and the not so old. So this is a real issue, and that's why I'm on here all the time trying to clear up this confusion, because you don't see this type of confusion in men's health. You don't see this type of confusion about heart surgery. You just don't. So why is it like this? And I think it's because of the lack of proper measurement. All right. Now, here's the surprising thing. You would think women would come in because of irregular bleeding or low libido or gaining weight. No, the number one problem was exhaustion. That was the number one complaint of these postmenopausal women is physical and mental exhaustion. And you look over here, it says exhaustion also included lower performance, impaired memory, poor concentration, and forgetfulness. And I've been talking about that, about the high performing women or just women, that's what happens. They lose their ability to perform like they used to. And that's really what I hear more than anything is exhaustion, brain fog. That's usually the first thing. So now the other issues were irritability, depressive mood, and anxiety. Now, if you guys have been listening to me, you know that if you're postmenopausal, you have a depressive mood and anxiety. A lot of times that's due to the lack of progesterone, because progesterone is a antidepressive, anti-anxiety hormone. So if you really understand what these hormones do, you can, as a patient, as a layperson, if you understand what these hormones do, you can accept or reject any advice that you might give because you know what these hormones do. And that's what I'm trying to get across is to teach you how these what these hormones do and how they work together. All right. So I love in the chat if you say, hey, look, yeah, that's me. I'm totally exhausted. And so let's have a little dialogue here. All right, so let's go to the next slide. So what did they measure? See, this was just about reporting symptoms. Okay. That's all it was. Nothing was measured. They looked at menopause stage by self report. They looked at demographics and co founders. So that's what that's is what I think causes the problems is that most doctors are basing their treatment just on symptoms, no other measurements at all. So if you only go by symptoms, different women can have different symptoms but have the same problem. And that's why you need some type of testing to figure out, is it a relationship between estrogen and progesterone that's a problem? Is it a cortisol problem? Is it really a testosterone problem? What is it? So that's why I'm saying you have 52% more symptoms. We know they have more symptoms, but we really don't have a clear answer about what's going on. All right. Next slide. All right. So this is kind of a joke, but anyway, because women come in exhausted, people, and I've seen this and I've heard it over and over again, and I'm wondering, why are so many people on testosterone? Why are so many women on testosterone? What is going on? When I was training, we never gave women testosterone. Now all of a sudden everybody needs testosterone, and the reason why is that these women are coming in exhausted. They're given testosterone, and it's not being measured properly, and therefore you get side effects, and one of them is losing your hair. And that is like a badge of honor for women, is that you don't want to lose their hair. So, so a lot of people are given testosterone because they're told that it gives them energy because the complaint is exhaustion, but that's not necessarily what is going on. So, hey, Rebel, if they have any questions, you can let them come in or show them up on the chat, and I'll try and answer them as we go. Because I hope there's some people on here who've been told they had needed testosterone, or took testosterone and find out that it's not doing exactly what they wanted it to do. All right. So, if the number one symptom in perimenopause is exhaustion, then that's what we need to talk about. What is causing this exhaustion? You had almost 8,000 women in 20 countries, and this was done just recently in 2026. All right. So here's how it works. A patient comes in, they say, I'm exhausted. Doctor does a blood test. Usually the blood test you're going to get is they're going to look at your blood count, they may look at your thyroid, and then they look at your female hormones and they add testosterone in there, and they see that testosterone is low. So they prescribe testosterone. And you're going to see uh, when I show some of the scientific studies that testosterone is not what you need if you are exhausted, right? Because the testosterone gives you a temporary energy boost. That's what you're asking for, is you want more energy. It is not a fix for exhaustion, and it's just not. All right. Testosterone is not, it is a male hormone. All right. So it masculinizes you. Okay. What happens in men? men, as they get older, they lose their hair, as you can see, and it makes them grow hair where they don't want it. So I tell women, it makes you lose hair where you want it, and it makes you get hair where you don't want it. All right. So testosterone will give you a temporary boost, but as you'll see, it's not the fix for exhaustion. And when you don't match the right hormone with the right deficiency, more than likely you're going to start getting some type of side effects, right? Yeah, I get these notices from the Facebook groups. I want to just read some of these so you can see how much confusion is out there. I wonder if anybody out there who has some of these symptoms. So I'm hearing a lot of negative side effects from pellets, and I don't know if you know about pellets, but that's been a trend here lately. And they're giving estrogen and testosterone pellets to women, and pellets are these little things that look like I don't know, smaller than a bullet, and you put them underneath the skin, and they slowly release hormones over the course of time. So they're released underneath the skin into the subcutaneous fat tissue, and you remember that hormones are fat soluble. So that's why you can put them under the skin and the fat, and they'll actually dissolve and actually go into your system, and you get effects from it. So that's what a pellet is. So a girlfriend of mine just got her second set inserted, and her testosterone is sky high. So I don't know why they inserted a second set, but they said after this they would retest her, and I hope she just. So now again, they're going to test her, but they're going to test her in the blood, and it will show it when you have overdosed a person, but it's not going to show you when they are in the right balance because, as you know, blood just tells you what's circulating. And the only reason why that hormone from the pellet gets into the blood is after the tissue is saturated. All right. So I want you to hear that. So by the time it's in the blood, by the time the blood level increases, then usually the tissue is saturated. All right. That means that it's so high in the tissue that it goes back into the blood. Right. Now, this is another lady, just got my lab results back from a third pellet. I get testosterone and estrogen in a pellet and take progesterone by a pill every night. Let me tell you another problem with that is that you do the pellet so that somebody doesn't have to remember anything for 3 months, because every 3 months they get the pellet. So only 4 times a year do you have to worry about replacing your hormones. But here's the unusual thing. So that is to increase compliance, but you still have to remember to take your progesterone pill every night. So that is more likely you're still going to forget the progesterone pill, and that's very important in order to balance the estrogen that's in the pellet. So that's another problem. Now, some people do progesterone pellets. I actually do that, but yeah, it's a problem. So it really doesn't make any sense to. I see the questions up, and I'm gonna stop in a minute. We'll go through them. Okay. All right. So has anyone else had these types of levels, and how did they feel? And that's why I'm saying they're asking other people, not the doctors. Not they're asking other women who are having the same issues. All right, so well, she wanted to prescribe medicine for the acne. The medicine is a testosterone blocker. Doesn't make sense to pay for testosterone pellets and then take an oral medicine to block it. So, I tell people, when I give you something that you need, what will happen is that a lot of things will get better. You give somebody, you treat their cortisol, you treat their progesterone, whatever, and they get better quickly because it's exactly what the body needs. When you give something they don't need, then you start to have problems. And you may be giving bioidentical testosterone, but you begin having problems because you're overdosing the person. Okay. And so now they have to get something to block the testosterone you just gave them. So unfortunately, most doctors have not studied menopause in 25 years, and is not taught in medical school. So right now they're only 6%. And I think I've done a video. I actually did a podcast on this study that said it really was 9%. Only 9% of doctors felt like they understood menopause and could treat patients. And women keep going back to their doctors when they aren't up to date on BHRT. Women need to be their own advocates, and that's my issue. I want you to be your own advocate. That's why I'm on here trying to teach you guys. All right, now think long and hard. And I'm not saying anything about these particular pellets. This is a face after 1 year pellets. I didn't even have acne as a teenager. So acne, hair growth, hair loss, that's what you get with long-term use of testosterone, especially if it's not monitored properly. And how do you monitor it? With saliva testing. You guys should know that by now. I'll answer a question. Can you show the question again? How do you notice the symptoms? Well, this is how I say it is that if you are not functioning like you used to or like you think you should, that's the exhaustion that we're talking about. And usually by the time you're in perimenopause, 40, 50, that is the time where you have all these other stressors. Okay, usually children are growing up, maybe you're ready to go to college. Your parents are aging, so you got those issues. You might be having financial issues or relationship issues. So all of those things happen around perimenopause, and that is more likely to be a problem with cortisol than it has to do with testosterone at all. Right. So how do you notice the symptoms? Again, you need to compare yourself to, and usually the decline comes after a stressor or after several stressors. So if you've been through a lot, the stressors have gone away, but you still feel exhausted, I'm going to show you what's happening there. All right, we had another question. If you put them over on the side, I can keep up with them. Oh, I see. Here we go. All right. So I see them over here now. Life gives you physical and mental exhaustion. How can you tell the difference between daily overdue and anything else? What I would tell you that the problem is how you can tell the problem is that if the stressor is over and you still feel like that, because when you're going through the stress, your body a lot of times will step up to the challenge. But then after it's over, your body has to recover, and a lot of times you'll get this exhaustion. And I'll show you. I'll show you how it looks on a saliva test. All right. Uh, does testosterone make you lose your hair? Yes, and I'm going to show you why it makes you lose your hair. Does your body naturally make testosterone after menopause? Yes, it does, because your adrenal gland, which sits on top of your kidney, it can actually make testosterone, and it makes testosterone. It really makes testosterone on an even scale. You don't At menopause, you don't lose testosterone. You lose some that comes from the ovary, but you still have a backup, the adrenal gland. And women only need a small amount of testosterone. And actually, it's very hard to measure testosterone in women in saliva or in blood because there's such a small amount. It's hard, very hard to even measure testosterone in women, especially in the blood. So a lot of times, everybody looks like they're low, and I'll show you. All right, so now I want to make sure you understand that this is not me saying this. I'm not anti testosterone. I'm not anti pellets. I'm not anything. I'm just trying to understand the science and help you understand it so you can make better decisions. And you're not on these Facebook groups asking other women the information that you should already know. All right. So the global census position statement on the use of testosterone therapy in women. So this is a global consensus. Remember that study looked at people from 20 countries. So they're talking about this is their recommendation. All right, so let's look at this. Can you remove that so we can talk about? So testosterone therapy in women is not indicated for fatigue or low mood. No proven benefit for cognition or weight. No blood level diagnosis, no blood level diagnosis androgen deficiency. So that's why I want to tell you. So even a blood level, it doesn't tell you if there's an actual deficiency. Levels cannot identify sexual dysfunction. Judge a response clinically to this is the hyposexual desire, and test only to avoid superphysiologic levels. And that's what I'm telling you. The only time you're going to see it in the blood is when the hormone is supraphysiologic. That means it's above the normal range. That's the only time you're going to see it in the blood. So if you give a woman enough testosterone so you can see her blood level rise, it almost at least this study is saying, hey, you're seeing that because she has a super physiologic level. All right. And so hormones are like this. Too little hormone is a problem, and too much hormone is a problem. So that's why you want to test accurately so that you can get in the sweet spot of the level of the hormone for the tissue. Right. Now, this is what I want to get to. Cortisol is what mobilizes glucose so you have energy during the day. Okay. So in that study, nobody even mentioned cortisol. Nobody talked about cortisol. And most people think when they are fatigued or when they're anxious, they think their cortisol is high. All right. But that's not the issue. And I will show you that. When you are feeling exhausted and you're anxious and you're like, oh, I'm so stressed, most of the time your cortisol is not high, because when you're stressed and your cortisol is working correctly, you will have enough energy or glucose to handle the stress. It won't seem overwhelming. But so if there's a problem with cortisol, it's usually not that it's too high. Now, what happens is you're handling the stress and it's high for a long time. And now by the time you're exhausted, the cortisol curve has decompensated. All right. Now, cortisol is your energy. And I want to get that across. And there's ways to measure cortisol. And if you measure it and then you identify, because usually cortisol is the initiating problem. Because when you are low in cortisol, you're low in energy. And when you're low in energy, your brain starts to it starts to distribute energy in a very conservative way. Your body is always trying to conserve energy. So what turns off first? Your reproductive system usually turns off first, because that takes a lot of energy. And then well, number one is your brain. Your brain takes 20% of the energy. So the brain fog is that your brain does not have enough energy to make the connections so that you can remember things and so that you can understand things. So that's why a lot of people have brain fog, is due to that. All right, next slide. So your doctor tested the blood, saw low testosterone, never tested the cortisol. That's the issue. They never tested the cortisol. And people don't even mention cortisol when we're talking about exhaustion. I see patients who come in, their ferritin level is low. And I talk to them and I say, okay, your ferritin may be low. There may be an iron problem, but let's look at cortisol. And I will tell you 9 times out of 10, it's a cortisol problem. It may be an iron problem, but it's also a cortisol problem. I see men who are on testosterone. They've been on testosterone for a long time. What happens is you usually get diminishing returns. So I'll see a guy, he's been on it for 3, 4 years, he's exhausted. Well, men have stress too. They can have cortisol issues also. All right. And I did this before, that this is not a rare pattern. This is not rare. So this is how you test cortisol in the saliva. You they collect their saliva over the course of the day, 4 times during the day, when they wake up, around lunchtime, around dinner time, and right before they go to sleep. This is how a normal cortisol curve should look. Let me go back here. This is how a normal cortisol curve should look. And you can do this all through saliva. These are the 4 points. This is how it should look. You should wake up in the morning, have a lot of energy that should dissipate over the course of the day. You eat lunch, you get a little bit more energy. This is dinner. Now it's time to go to sleep. You have a nice restful sleep, and you come around and you do it all over again the next day. That's how cortisol works. So if you don't wake up with energy, if you don't go to sleep at night, or you have trouble going to sleep, or you wake up at 2 or 3 o'clock in the morning, that is more of a cortisol issue than it is a testosterone issue. It can also be a progesterone issue, because progesterone helps to calm you. It slows the brain down. All right, so that's what we're testing. So look at this. This is not like a few of my patients. These are the test results I get almost every day. Is that so? Now this is how. Remember the curve that we just showed you? It's really mimicking this. So this is normal. Wake up in the morning, a lot of energy goes down. This is lunch, dinner. That's how it should look. This black line right here, and Rebel, can they see my cursor?
No.
Okay. So let's look at the upper. So we're looking at the upper left. So the green area is normal. Okay. The yellow area above that is borderline high. The area above that is high. All right. So red is high, yellow is borderline high, green is normal. Light blue is low normal, and really in the blue, you're really wiped out. Okay, so let's look at the lady on the upper left. You see that black line, how it's almost flat at the bottom? That's really what you would call burnout. She has no energy. Okay, her energy should be up in the green. And now, if she has no energy, what happens is everything is more difficult because her brain doesn't work. She feels different. She doesn't understand why she can't sleep. Why is she so tired? She may sleep and wakes up still tired. And I'll tell you, all of these women, if you talk to them, and the reason why I do the test is that they've had multiple stressors. It's all of these 40, 50-year-old women who are dealing with all of those problems from both sides of their family, the children and their parents. And that's the life we live now. And this is so common, but so few people understand it, so few doctors actually use it. And so let's look at the middle one. You see this, the black line? Look at the one on the upper right. Same issue. It's abnormal. It doesn't have a normal curve. And if you look at that black line, you see at night when she should be asleep, it's up in the red area. That's the one on the upper right. And see the black line is up in the red all evening. So she's going to have a difficult time falling asleep, or she may wake up at 2 or 3 o'clock in the morning and not understand why. So let's look at the bottom left. Same thing. The middle is just a disrupted curve, and then one on the bottom left, that's another burnout. Okay, this person is going to be tired all day long. Okay, does the body have a natural rhythm that keeps this in order? Yes, this is the natural rhythm. All right, now I will tell you, if you want to have a natural rhythm, you've got to, your rhythm is based on sunlight. So if you want to have a natural rhythm, you need to be exposed to the sun in the morning, because when you see that sunlight, it turns on a clock in your head that 14 hours later, you should be sleeping. All right. That's what this is a 14-hour curve. It, 14-hour curve, in the right season. All right. And the reason why you go to California, if you're in the East Coast and you go to California, if the first 2 or 3 days or 4 days, you're going to wake up at 4 o'clock in the morning, California time, because your clock is set on Eastern time. Now, if you stay out in California long enough, your body will adjust to the sunlight time in California. And after 5, 6, 7 days, you'll start to acclimate because now it's seeing the sun at a different time. So that's how your body keeps score. All right. That's how that works. So you need to get morning sunlight so that you can have a normal rhythm. All right. If you are always under artificial light, you don't see the sunlight, your body has a difficult time figuring out what time of day is it and what should happen at certain times of the day. Because there's times in this clock that's the best time to eat, it's the best time to sleep. So yes, your body has a natural rhythm. It's called chronobiology. It's biology based on time. So there's certain times that it's best for your body to eat, it's best for your body to rest, and so on and so forth. All right. So you see that this is not a rare pattern, and that's why I'm trying to get women and men to talk to their doctor about it. The reason why I started doing saliva testing because a patient asked me a question, and so you need to ask a question. Hey, have you heard about cortisol? I'm hearing that cortisol mobilizes glucose. Could that be a problem with my exhaustion? And if enough women or patients go in and start asking the doctor has more incentive to go and learn about it. Now he may want to go learn about it because he wants to dispute what you're saying. And that's what I wanted to do when the patient told me about progesterone and saliva testing. Then I studied it and I'm like, oh my gosh, she's right. And 25 years later, I'm still going with that. Okay, what if you are used to being awake longer than being asleep? What if you're used to being awake? Now, again, you can change your circadian rhythm. That's what that's called. Just like if you move out to California, you will acclimate to that. If you if you have moved to stress California, okay, so if you are chronically stressed, your body will adjust to that time period. Okay, so if you adjust your body to stay awake all day and not go to sleep, then your body will eventually adjust to that. I'll tell you one way that your body adjusts is that women who have children, when they are infants or babies, their nighttime cortisol goes up. That's why women can hear the baby, make a sound 2 rooms away, and the husband can't hear a thing, because it's kind of a maternal instinct that you don't want to have a deep sleep at night. So your cortisol curve will go up. And a lot of times, especially if women have had a child that may have had SIDS or was in the ICU and they're hyper vigilant, then the cortisol will raise so that they hear every little sound. So they have a real problem going to sleep. And even after the baby has matured and everything's fine, they may still find that it's hard for them to stay asleep at night because they have this hypervigilant cortisol. So that's why I'm telling you, cortisol is so important. And I really believe that those 52% of women who had a higher score than premenopausal, that cortisol was their problem. Now, the study said, oh, it's due to fluctuating estrogen and progesterone, and that's correct also. However, the missing piece is the cortisol. And that's what we found out when we wrote our book, Are Your Hormones Making You Sick? We wrote that first. And then 2 or 3 years later, we understood that stress was really the culprit. Okay. And so we wrote the book, The Stress Connection. And that's how we do it now. We start from the top going to the bottom. So the top of the pyramid, I think most of the time, is cortisol. And then all the other stuff, estrogen, progesterone, testosterone, all of that, it feeds off of this dysregulation. All right. So it's time for a break. We'll come back. Please, if you have some more questions, that's fine. I've got a few more slides. We're going to talk to you exactly how testosterone, what it does do and what it doesn't do. All right. So we'll see you after the break.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
All right, so we're back, and we're talking about this study that showed that women that perimenopausal women have a lot more symptoms than premenopausal women. And I think that's pretty obvious. And okay, I'm watching my podcast with my wife. First, thank you for making this information for free. It has been here. My question is, when should cortisol testing be considered? If you have had a lot of stress and now you're exhausted and wonder why you can't recover, I used to ask, people would tell me about all of these things going on in their life. And the reason why I asked that is because it said 75 to 90% of all visits to primary care physicians are for stress related complaints or disorders. So a long time ago, 20 years ago, I said, I'm going to be an expert on stress because 75 to 90% of the patients are going to have issues involving that. So that is what you need to understand. I will tell you that if you have a pattern like this where you wake up and you're still tired, and if you've had a series of stressors or one big stressor and you feel like you haven't recovered, I'll ask patient, do you feel like this stress changed your health? And almost always they will say yes. They know that something happened and all of a sudden their health deteriorated. But a lot of times we don't have enough time to go that far back because we're so eager. And I'm not bashing physicians. This is just how the system is. We're so eager to write a prescription. So if we see something, oh, testosterone's low, let's give them that without really thinking it through. So I would tell you that if you're asking the question, you probably need to cortisol test it. And I will tell you in this, the way the world is now, everybody's stressed. Everybody's stressed. If you talk to them, everybody's stressed. All right. So I would tell you that if you're feeling like that, you ought to get your cortisol tested. And there are ways to improve this. We do it with IV therapy. We do it with adaptogens. We have a product called Adrenocare Glandular that we do before and after. As we see something like this, we treat them and we retreat. We retest them, and we see the improvement not only in their symptoms, but we see the improvement in the measurement also. Right? Low energy always be blamed on menopause. No, you can be. I've seen abnormal cortisol curves. I've seen abnormal cortisol curves in people as young as 16, because the stress and the pressure now on these kids to get in the right high school, get in the right college, trying to get a job. So this is not just a menopause thing. This can be at any age when someone has gone through a stressor. And it doesn't necessarily have to be an emotional stressor. It can also be a physical stressor. And menopause is a physical stressor. So if you have a lot of emotional stressors, and now menopause comes because it's a stressor, because it is a change, it is a recalibration, it's a transition. And so you have all these emotional stressors. Now menopause hits, that's the straw that breaks the camel's back. So that's why a lot of people blame low energy on menopause, but it's really that change, that physical change, along with the emotional stress, that seems to be what does it. All right. So she's on testosterone and she never even needed it. So for a problem that testosterone doesn't even solve. So she didn't need the testosterone, but she got the testosterone and it didn't solve her problem. And that's why the title of that slide was, I'm still exhausted and now I'm losing my hair. And actually the quote was like, uh, I'm exhausted and now I'm bald. So it really didn't help anything. So somebody was asking, how does testosterone cause problems with your hair? Well, there's something called DHT that testosterone can get converted into, and this DHT does a lot of things that people don't want to do. And one is to lose their hair, and that does that in men and in women. The other thing, they think DHT may be a part of the contribution to stimulate growth in a prostate cancer. So it may not be the testosterone, or it may be the conversion of testosterone into DHT, and that's just a long. DHT is an abbreviation for something called dihydrotestosterone. So just that's what DHT is. All right. So I think this is a so here's what happens, and we've talked about that. You have exhaustion. The doctor blames testosterone, prescribes the pellet. You get hair loss, you're still exhausted, and the real problem is cortisol. And I keep talking about cortisol. I'm going to talk about cortisol until I'm blue in the face, because I think cortisol is the root cause of a lot of problems. Is that, stress just, it is connected to everything. That's why we uh, named the book The Stress Connection, because it's connected to everything. So, doctor, my question is: two women with same symptoms need complete different treatment. This is why I don't believe in social groups. Exactly. That's what I'm saying. Why are you going to Facebook? And see, the problem is, I think, with the medical education system. You saw that only 6 to 9% of doctors felt like they understood menopause. I did a podcast last week talking about how menopause and women's hormones have been an issue for centuries. Okay, I mean, they were confused about what to do with menopause back 10,000 years ago. They had women in huts. When they would have a change in their mood, they thought that they were possessed. So all kinds of things. We've always been confused about hormones, and I'm trying to end that hormone confusion. I'm trying to end it now, and I'm trying to end it so that you can educate your daughters, and more people can understand this, and husbands can understand their wives and what they might be going through. I just have a free download. It's a man's guide to hormones and women's hormones, because you need to understand these transitions that women are going through, and you need to be supportive. But a lot of times you don't understand it, you take it personally. But I want everybody, I want hormone confusion to end for doctors, for the Facebook groups, for men, for women. is that we've got to come to a conclusion. If we can go to the moon, we can go to Mars now, but we still have confusion about hormones, thinking testosterone is going to give them energy and not cause side effects. If you give the wrong hormone, you're going to get the wrong outcome. And that's with anything. So I think that's okay. So what do you do? And let me just make this clear. You're not going to get the right answer if you're only testing the blood. You're just not. And that's why these women are confused. That's why doctors are confused. Because here's what happens. They think the doctor thinks it's a hormone problem. They look at the blood and they say, wait, everything is normal. So it can't be hormones. So then they start doing other things. Okay. They send you to the endocrinologist. They send you to the rheumatologist. They send you to the psychiatrist because that initial blood work is not telling them what's really happening. So that's why you look in the saliva. Because if you just do a morning cortisol, it's not telling you what's going on in the pattern for the whole day. So you test cortisol in saliva. You test testosterone with saliva. You test estrogen with saliva. You test progesterone because they're all fat soluble. That's why you can put the pellet in fat and you get an effect because it's easily extracted in fat tissue, right? So that's why you have to use saliva because blood testing is not going to show you the tissue concentration of the blood test is not going to show you the tissue concentration of any fat soluble hormone. All right, so we got one more. Is there a saliva test for men? It's the same test. Okay. Now let me tell you what happens in men. They get overdosed with testosterone. When you take too much testosterone, it starts to you have diminishing returns. It's oversaturated, so your body it gets desensitized to it. So the same test, we do the same saliva test on men and women. Now, with men, we're looking at their estrogen level and their testosterone level, because just like testosterone can get converted to DHT, testosterone can get converted into estrogen. So if you have in the fat tissue, so if you have a overweight guy and you give him testosterone, some of that testosterone is going to be converted into estrogen in the fat tissue. So you have to be careful with that, and you're not going to see it in the blood. Okay, so can you tell us more about DHT related to prostate issues and what need to be done about that to fix? Now, let me be clear about this. Testosterone does not seem to, and this is what urologist says. The last I heard is that testosterone doesn't cause a cancer, but if you have one, it may stimulate its growth, right? So that's what you want to know. If you're on testosterone, I'm telling you it's going to cause cancer, but you do want to make sure you don't have too much because let me tell you, is that the prostate is embryologically like a woman's uterus, so it is actually sensitive to estrogen. Okay, so it's not really high testosterone is really too much estrogen that can stimulate the growth in the prostate. So you want to look at all of those hormones and note this: it's not a men's saliva test or a woman's saliva test. You do the same saliva test. Let's say in third world countries, the concept of saliva testing doesn't really exist. It doesn't exist here. What should I do? I don't trust blood tests because I'm a regular viewer of your podcast. Yeah, I don't know. I think you were on last week, so I remember. Yeah, I don't know what to tell you, but you're right. You can't trust blood tests. Okay, I would tell you that if you weren't going to do anything, the safest thing that you could do if you're having issues is you could try to get progesterone over there because a lot of these issues are due to progesterone going down. And hopefully there's some adrenal supplements. And the supplements that you use for cortisol are these adaptogens. Adaptogens are called adaptogens because they help you to better adapt to stress. And those are things like ginseng, rhodiola, cordyceps. All of those can help. We actually have this in a combination because the combination products work better than I think taking a bunch of separate different supplements. So that's what I can tell you. But here's what I want you to understand is that if you understand this, you will know what to accept and what to reject. Okay. So you'll know that, hey, look, if I'm perimenopausal, it doesn't necessarily mean I'm low in estrogen. But I told you that 100% of women will stop ovulating. So 100% of women will their progesterone will go down. And usually the progesterone goes down more than the estrogen. So now you have an imbalance. And how you correct it is you try to take progesterone. Now, in the third world country, if there's you may be able to find chase berries. Chase berries is a berry that actually increases your progesterone. So that's something you could use even if you don't have a doctor who will prescribe it. Yeah, and when you're taking something like that, your body kind of is able to self-regulate it instead of me giving you a dose of something and it may be too high or too low. So chase berries can help with, and you may find it in. Uh, I know one of the products is called Vitex, and we also have chase berries in a product we have in Taylor MD formulations called Latex. And you can go to all my links and you can see everything that we offer. So I would encourage you to do that. I also want to encourage you to subscribe to my YouTube channel, subscribe to the podcast, follow me on TikTok. I told you there I was talking about PMDD and got a crazy response. So these hormone issues are important. That's why I'm on here every week. They're important. So tell somebody else about it. Send it to them. Show them my YouTube channel. I got so many videos on there, and it's all just trying to educate you so that you can go into the doctor with confidence. When I first started this, the first lecture I ever gave was to lay people, was I could make you an honorary gynecologist. I can make you an honorary gynecologist if you understand these hormones, you understand how to test them, and you can help somebody else, because I hope you're learning enough on here where you can go and help someone else, where go on those Facebook groups and say something. Tell them, tell them about cortisol. Tell them about. So get on. I need people to be on those Facebook groups to help those women, because a lot of these Facebook groups they won't let a man comment, but this one I get to see some of the posts, and all of them are just so confused. And I need somebody to be the voice of reason on these Facebook groups, and I hope I'm teaching you enough to do that. So if you're still on here, give a comment and you say, "Yeah, I'm going to tell somebody else about this." Okay, so I hope that's what you do. If you had questions, believe me, your friends have questions, your girlfriends, your church members, everybody has questions. And again, I hope that this is something that broadens your horizon. And even though I know that most of the information that you're going to see on the internet is only going to talk about estrogen, and they may talk about testosterone. You're going to hear very little about progesterone and cortisol. And I believe that is the main cause of the confusion. All right. So, hello, Dr. Taylor. Thank you for making hormone education free and accessible. Your work is creating global awareness, and we're grateful to be learning from you. All right. Thank you. Thank you so much. And again, sometimes I get up here and I'm like, oh, I hope this is helping somebody, but I'm dedicated to this. I'll keep showing up. I'll keep showing up as long as there's confusion about hormones, and that seems to not end quickly. So it's almost time to go. Hey, Rebel, you have any comments before we leave?
Wow, so much is packed in here. We have a lot of guys asking about that testosterone issue
Oh,
in
yeah.
men.
I don't mean to scare you, you guys. Okay, I don't mean to scare you, but I would tell you that you want to get tested to make sure you're not converting it into estrogen. So if you're on testosterone, I'm not telling you to stop. I'm not telling you it's dangerous or anything, but I will tell you is that here's what happens when you do your initial blood test. Your testosterone may be legitimately low. However, if you take testosterone, the blood level is not necessarily going to give you an accurate amount. And it's the same way with men as in women. By the time the testosterone level gets up in the blood, I'm not saying all the time, but sometimes the saliva will show that you're severely overdosed. And that's why you're not getting the same result from the testosterone. Because what happens is you come in a year or two later and you say, "Hey, doc, this is not doing for me what it used to." The doctor increases the level. And then that doesn't help anything. Now he's more overdosed. And now he's wondering why the testosterone doesn't work anymore. It's because he's gotten too much. And I've seen guys, their I'm sorry, their blood level can be really high and they still have no libido. because they've gotten desensitized to it. So I want to be clear about that. I'm not trying to scare guys off of testosterone, but I am trying to educate you into understanding is that once you take testosterone that's not coming from your gonads, then the blood is unreliable. Okay, it'll tell you that your gonads aren't producing the testosterone on the initial visit, but then after that, if you're taking any kind of exogenous testosterone, then the blood is not reliable. All right, so I know we got to stop. It's 10 till. So I'll see you guys next week. Thank you for joining me. I hope this helps somebody, and I hope you help somebody else. All right. All right, see you next week.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discover the ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.